You're listening to the La Jolla Cosmetic Podcast with Monique Ramsey.
Move over, lipo. Eyelid surgery just became the most popular cosmetic procedure in the world. Today, we're talking about why blepharoplasty is suddenly everywhere, what's driving the demand, and what you need to know before booking your consultation. Joining us today is Dr. Kiersten Riedler, breaking down the trend and what it means for the future of facial surgery. So, welcome, Dr. Riedler.
Thanks for having me.
And let's talk about eyelid surgery. So it's kind of been for years that lipo is like the most popular procedure, consistently for like 20 years probably. And so all of a sudden eyelid surgery has sort of dethroned lipo globally for last year in 2024. So what does that tell us sort of about shifting patient priorities and aesthetic goals?
So I think it tells us that people are focusing more on the face and especially the eyes. The eyes are central to communication and expression, and people are, more interested in looking alert, refreshed, kind of approachable, and so they're kind of prioritizing a relatively like low downtime procedure that can impact how people perceive them and kind of their social interactions, um, and maybe focusing a little bit less on their body, especially. Because with selfies and social media, I feel like the focus tends to be a little bit more on the face, but I'm also biased.
Right, because your surgery is really limited to like above the clavicle, right?
Yeah.
Yeah. So now the International Society of Aesthetic Plastic Surgery, which is also known as ISAPS, their report cited a 13.4% jump in eyelid procedures. And that's a lot. I mean, in 1 year.
Yeah.
So obviously, I think your point about selfies and, all these Zoom meetings that we're all on all the time, it is kind of maybe the first place that people would see aging, do you think?
Yeah, definitely. In my opinion, I think for most people on average, the first area that tends to show aging changes are the upper eyelids. Um, and then maybe the lower eyelids and then maybe the neck. But a lot of people in their, late 30s, early 40s are noticing some upper eyelid aging changes. And so I think that's one reason too why people are focusing on it, because we're seeing younger and younger patients coming in.
Yeah. And I think, like you see on TikTok and on Instagram, there's, influencers and people are, and I love the fact that people are so open about their procedures
Yeah.
because it really destigmatizes it. I mean, back in the 90s when I started in this business, some people talked about it, but certainly people were a lot more secretive about it.
Definitely.
And I think now everybody's like, yeah, why not do
Yeah.
it? It's like coloring your hair. If you wanted to fix it, do it, right?
Exactly. It's nothing to be ashamed of.
I guess for aesthetics, like is eyelid surgery for just looking better, or is there some function that is helped when you have a upper blepharoplasty?
Yeah. So for the upper eyelids, I mean, most of the patients I see are primarily focused on the aesthetic changes, but a lot of patients will notice kind of heavy upper eyelids. Some people can get headaches because they're using their brows to kind of lift their heavy upper eyelids. And so that can cause headaches. That also causes forehead wrinkles. um, and I mean, sometimes it can be, pretty severe, and it can actually limit people's peripheral vision in some cases. So there can be a functional component of it as well, for sure.
And do you find that patients' motivations for having are they different whether they're thinking about their upper eyelids or their lower, or is it just kind of like help me look younger?
For the upper eyelids, it tends to be more like kind of heavy excess skin, hooding, um, feeling like they look tired. For the lower eyelids, people often will also say that the lower eyelids kind of make them look tired, but it's more like puffiness or bags or excess skin as well. So it's a little bit of a different kind of goal or like complaint that I see regarding upper versus lower eyelids. But in general, I think most people come in saying, I want to look refreshed. I'm tired of people asking me if I'm tired.
Yeah,
Even
yeah,
if I am tired, I don't want to look like it. And when I'm not tired, people still ask me if I'm tired. So, yeah.
right, right. And now, how does something like Botox play into eyelids? Because sometimes I've heard that, sometimes you can relax your forehead, but
Mhm.
then do your eyelids droop a little bit, or is there more heaviness?
So yeah, so there's like an kind of complicated interplay between the forehead, brows, eyelids with Botox. And if your brows and your eyelids are basically in a good position and you don't have aging changes, then Botox in the forehead, crow's feet, glabella area isn't really going to affect or shouldn't really affect like the position and shouldn't really make it feel any different. However, if, as I mentioned, you have heavy upper eyelids and you're using your forehead muscles to raise your brows to alleviate that heaviness, and then you use Botox in your forehead to treat those wrinkles, then because you have a decreased ability to lift your heavy upper eyelids, they can feel quite a bit worse. So it's sort of
Yeah.
like you're compensating and then you can't compensate, but it isn't necessarily
Ah.
the Botox in itself is causing the heaviness.
Well, and I know for me, because I'm kind of getting to the point where, that might be helpful because my makeup, then it's
Yeah.
like you go to make your crease in your makeup and then things start making other creases in places
Hmm.
where you're like, I didn't apply it there. Why is
Yeah.
it moving? And that can be super irritating. So do you find that the people like who is looking for eyelid surgery? Is it mostly men, mostly women? What ages?
I mean, it's a big range of ages from like late 30s to 70s. I'm definitely seeing more. I'm seeing younger people. I'm seeing more men also. Um, but it's really kind of like everyone. There isn't one like certain group of people who comes in for eyelid surgery. It's kind of a pretty universal thing.
Yeah, and men really, like you say, it's, you know, I think men are embracing cosmetic
Hmm.
procedures more and more, which I think is great because then they don't have to, I saw a guy come in the other day and get his pedicure when I was getting my pedicure. I'm like, good for you.
Yeah, why not?
It doesn't have to be just a girl's thing.
Yeah.
And it was interesting in the International Society report, that more men were starting to do eyelid surgery than they did before. And would you say, like, what percentage of the eyelid surgery you're doing is on men?
I'd say probably like 20-25%.
Do you think there's any lifestyle factors like excessive screen time or Zoom calls or, I don't know, whatever, wearing masks, I guess, even,
Hmm.
or people maybe even in medical, dental hygienists. That's
Yeah,
all you see is their pretty eyes.
exactly. Yeah.
Is there anything that you think might be driving the popularity?
Yeah, I think definitely like during the pandemic when everybody's wearing masks, only thing you can see is your eyes and your forehead, really. So that really put in more of an emphasis on the upper face. And that's when we started seeing more like, lash extensions
Hmm.
and microblading and, things to like enhance the eye area. And then also like during Zoom meetings, FaceTime, things like that. I think usually you're interacting with people looking at their eyes. And so people are more aware of other people's eyes and they're more aware of their own eyes also. So definitely, I
True.
think all those things have like played a part.
So if it's top of mind for people and, you're out there listening in the audience and you're thinking, maybe it's time for me, but you don't know. Sometimes you think, well, is it just me that's feeling this way? Or, is it too early? So a consultation there's no charge for a consultation in our office.
Mhm.
And, what would be the tips that you would say to people, if they're thinking about having the procedure, what would you recommend for people to do to get started and what to look for?
I mean, you want to look for a qualified surgeon, board certified facial plastic surgeon, plastic surgeon who has specialized training in eyelid surgery. You want to look at before and after photos, not necessarily to see somebody who looks exactly like you, but just to look for like natural results. Like, you want to see that people have good outcomes and look like themselves, but better in general. And then the consult is, a great step because we don't expect you to know what what you need to meet your goals or, to
Mhm.
address what's bothering you.
Well, and if we're talking about eyelid surgery, so I know there's different combinations of things. You could have upper and lower. You could have upper skin only or skin and fat. Your lowers could be skin only, skin and fat, right? So kind of give everybody a little bit of a overview of, the types of procedures they can do with their eyes and maybe even sometimes their brow.
I mean, I always kind of like look top to bottom. So I look at the brows and are the brows in a good position? Is somebody constantly using their forehead muscles to raise their brows? And is that because their brows are low or because their eyelids are heavy or both?
Mm,
So looking at that, and then looking at the upper eyelid skin, the fat that can kind of bulge in the center, and then also looking at the lower eyelids. Is there excess skin? Is there bulging fat? Is there hollowing? Everybody's eyes, everybody's face, everybody's eyes are different, which is why my job is so interesting. But everybody like can, maybe benefit from a slightly different combination of procedures. And so I would say the main things that I'm, you know, considering for patients who come in with eye concerns is brow lift, upper eyelid, upper blepharoplasty, which can either just be the skin or sometimes the fat that's bulging in the center, and then lower blepharoplasty, which can also involve like the skin or often the fat that's bulging as well. And I often like to combine the lower blepharoplasty with fat transfer because
mm.
often people have, in addition to like bags or bulging, they have some hollowing down here too. And so I think that really is a nice addition to make a fully like smooth contour.
Yeah. And speaking of that area, so, I know that there's in the past, and maybe still continuing now, some people put filler under their eyes. And you work in our med spa, you work in our surgery center. So you see both sides of that part of, ways to fix things.
Mhm.
And, to me, like I had long, long, long time ago, I had filler in my lower eyelids. And, it was like 8 or 10 years later that all of a sudden there was this weird greenish bizarre thing
Mhm.
happening, and it was like you think the filler's gone but maybe it's not, and there's this weird bulge, and so we ended up dissolving the filler. It was like,
Mhm.
oh. So tell us about, like, what do you think about fat versus filler?
Well, I will say that I see that kind of situation a lot. And I do see quite a few patients come into the surgery center for lower blepharoplasty. And I know there's filler. I can see filler.
Mhm.
Um, and it is, I mean, patients often think, oh, it was 2 years ago, it was 4 years ago, but it really does stick around a long time.
Mhm.
Luckily, it's dissolvable. So if that's causing an issue, we can get rid of it. No problem. I do definitely prefer fat over filler in that area because, as you said, like it can cause the filler can cause problems later on down the line. It can cause kind of chronic swelling. It can cause what's called a Tyndall effect, which is
Yeah,
kind of like
that's what I had.
exactly, like a bluish discoloration.
It's so weird.
Yeah.
All of a sudden I was like, what's happening? And I was up in the med spa and Kara was like, oh yeah,
Mhm.
it's filler. I'm like, no, I had that in like '09. No joke.
Exactly.
Like when it first got indicated,
Mhm.
and it was like, how could that be?
Mhm.
So she's like,
Exactly.
it is.
Well, good job, Kara, for recognizing it.
Yeah, right. Exactly.
Yeah, exactly. But and that's not to say that filler is always bad or anything like that.
Mhm.
Um, but I mean, especially when doing surgery, I really prefer the fat transfer in that area because I think it's kind of replacing like with like and a good correction for the
Mhm.
problem. But filler in some areas also like the cheeks, things like that can help kind of support and balance the face so that that can help kind of camouflage some lower eyelid hollowing too. There are often like more than one option. There's more than one option to like address your concerns. And that's one reason I like working in the med spa and in the surgery center because I kind of am able
And you can
to,
kind of mix and match.
yeah, yeah, and let patients know what their options are.
Yeah, and are they trying to solve something super quickly,
Hmm.
for an event coming up? Or, do they have a little bit of time? Now, getting into like setting realistic expectations around results and around how long it takes to heal and
Hmm.
recovery, how do you talk about that with patients and what tips do you have?
Hmm. Yeah. So, I mean, we always tell patients in general with facial surgery, it takes a year to see your final result. That isn't to say that you're in the recovery process actively for a year, but
Mm.
face takes time to heal. So recovery wise, after eyelid surgery, I would say by 2 weeks you look, pretty socially acceptable. Um, you're not going to want to like take headshot photos or get married 2 weeks after surgery because you're definitely still swollen, still recovering, but most of the bruising's gone. Um, you're just dealing with some swelling still. And it does take, I would say, months for all of the swelling to go away. But at 2 weeks, you look socially, pretty good. And then it just kind of continues from that point forward. Generally, I recommend not scheduling any like major photos or events for about 3 months after surgery, just to give yourself like a nice cushion, so that if it takes a little while for your swelling to resolve, that you're in good shape.
Yeah, and everybody's different,
Everybody's so
Some
different.
people
Yeah,
in
it's
your age
unpredictable.
or your habits, your daily
Hmm.
life, just how I don't know. I think it's good to give yourself more time than less, right?
Definitely.
It can't
Yeah,
go wrong with that.
yeah. More time
Now,
is never a problem.
yeah. Now, is this something that you do under like a local with sedation? Do you do a general anesthetic or does it depend on the patient? Tell people a little bit about the OR day.
I mean, it depends on the patient. In general, we do these procedures under general anesthesia. Um, but some patients prefer, IV sedation, which is perfectly fine also. Occasionally, I'll do an upper eyelid surgery under like just local anesthesia. I would say less often, but if somebody's had anesthesia in the past and had a lot of nausea and vomiting or every case is different, so I
Mhm.
kind of talk to the patient about what the options are, what the pros and cons of each option is, and see like kind of what works best for them.
Now, would you, looking ahead at the trends that you see and the things that you're hearing what patients ask for, do you think eyelid surgery what kind of might stay there for a while? Is there another procedure that might take its place in the facial rejuvenation department?
I mean, I think eyelid surgery, I don't see it, declining in popularity because it is kind of like universal. Like it isn't for there are so many people who can benefit from it, and the results are long lasting. The downtime and recovery is pretty reasonable, um, and so I see why it's popular, and I don't know why it would change at this
Yeah.
point.
Yeah. And everybody's got eyes,
Yeah.
And
Everybody
so,
has eyes. Yeah.
it's like, okay, there's like lip lifts and you do beautiful, there's so many things that you do on the face that are that can rejuvenate.
Yeah.
But, not everybody needs a lip lift or wants a lip lift.
Yeah.
And, so it's like, yes, that's really popular, but it's not going to take over eyelid surgery. So, but this was so helpful. And if anybody in the audience, if you're listening today and you have questions or need help scheduling a consultation, we even have, and I'll put in the show notes, we have a new thing that you can schedule online, which is a call with one of our patient coordinators. You can schedule it yourself. So what's really nice is you're not playing phone tag. You can just schedule that. Then one of our patient coordinators, who are all very knowledgeable, can, talk to you about getting set up with an appointment with Dr. Riedler. It just kind of bypasses the phone tag or, being on hold forever. So, anyway, so we'll put that in the show notes because that's kind of new. And, a lot of patients really like the flexibility of scheduling it on their own time. So thanks, Dr. Riedler.
Thanks, Monique.
Thanks everybody for listening, and we'll see you on the next one. Bye.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to LJCSC.com or follow the team on Instagram at LJCSC. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.